Have you ever woken up and found a painful red bump on your eyelid and wondered, where did that come from? Or maybe you've had several styes over the years and want to know why they keep happening. In this video, I'll explain what a stye actually is, why they happen, who's more likely to get them, and what you can do to help prevent them. Before we talk about why styes happen, let's talk about what a stye is. A stye is a localized infection or inflammation involving one of the glands in your eyelid. Along the edge of your eyelids are tiny oil-producing glands that help keep your tears healthy and prevent them from evaporating too quickly. When one of these glands becomes blocked, bacteria can get trapped inside, leading to swelling, redness, tenderness, and sometimes a small pus-filled bump. That's what most people recognize as a stye, but medical professionals call them hordeolum, and we talk about them as either being an internal hordeolum or an external hordeolum. But here's the thing. There usually isn't one single cause. Instead, styes happen because of a combination of factors that allows the gland to become blocked. One of the most common reasons is that the oil coming from the glands becomes thicker than normal. When that happens, the gland opening can become clogged, similar to how a pore can become clogged on your skin. Once the gland is blocked, bacteria that normally lives on the skin around your eyelids can become trapped inside. This bacteria isn't necessarily dangerous, but in the right environment, they can multiply and trigger inflammation. Some people are more prone to styes because they have chronic eyelid inflammation, a condition called blepharitis. Others may have meibomian gland dysfunction, where the oil glands don't produce healthy oil consistently. There are also certain situations that can increase your chances of developing a stye. People who frequently rub their eyes, don't remove eye makeup completely, wear old makeup, or handle contact lenses with poor hand hygiene may be at increased risk. Styes can happen to anyone, but they tend to occur more often in people who already have underlying eyelid gland problems. So what should you do? Fortunately, most styes improve without needing any major treatment. However, the most effective thing you can do is apply a warm compress to the affected eyelid for about 10 to 15 minutes several times a day. The warmth helps soften the oils and encourages the blocked gland to drain naturally. What you don't want to do is squeeze or pop that stye. I know it looks tempting, but please do not do that. That can increase inflammation and potentially make the problem worse. Also, don't waste your money on stye creams. But here's the thing. If the stye continues to get larger, causes significant swelling, affects your vision, or keeps returning in the same location, it's a good idea to have it looked at by an eye doctor. Occasionally, what appears to be a stye can actually be a different eyelid condition. Most styes are more annoying than dangerous, but understanding why they happen can help you reduce your chances of getting another one. If you have an eyelid question, leave it in the comments. It might be my next video.